Hey, it's Jessica DaMassa with WTF Health. I'm here at AHIP's Consumer Experience and Digital Health Forum, and joining me right now, I have Ingrid Lindberg. She is the CEO of Chief Customer and an expert on customer experience. So this is obviously an industry that sucks at customer experience. I mean, it's like the worst net promoter score out there, right? Or is there one more below us?
So it's actually in order of horribleness.
Yeah.
So there's healthcare, so we're not that bad, but then there's big oil and then there's tobacco.
Hey, great company to be keeping. So how do we fix this? So what do we need to know about customer experience? What are we doing wrong? And like, what's the pathway to salvation? Is there a pathway to salvation?
I love the simplicity of that. Is there
a pathway to this?
So I don't think there's a super easy pathway to salvation, which is so unfortunate because we really created this messed up industry, right? And at the end of the day, what I always tell people, whether it's docs or whether it's people in insurance companies or wherever, is look, these are the people who are paying your bills. And what they frankly want from you is for you to be a heck of a lot easier to do business with. So we had a consumer panel that I was running not that long ago, and one of our consumers was talking about the fact that he actually had to sit on hold for 3 hours with a nurse to get an emergency approval for an MRI.
Oh my God. For
like
3 hours.
3 hours on the phone, emergency approval, MRI.
These words are just coming out.
Do not compute, right? And so, you look at that example, which is such a simple one though.
Everybody can totally like commiserate with that because we've all been there waiting on hold for an authorization of something.
Again and again and again, right? But in any other industry, right? So super simple solution to that one. Any other industry is we would say, hey, you know what? I'm gonna go look into it. I'm gonna call you back within 4 hours.
Right.
I'm not gonna waste your time. I'm going to go take that on myself because frankly, you're paying my paycheck. I'm going to go solve that for you. Right. So you think about things like that we do everywhere, and we just don't have that MO in this industry.
Why? Whose fault is this?
Well, frankly, I think that we spend an awful lot of time making it really, really complex because it makes us feel better about what we do. Right? It makes us feel important. It gives us job security. You look at the person who knows how to move that widget. No one else knows how to move that widget. That's my widget to move. And as long as I can protect that widget, I get to keep my job. And the more widgets we've added, frankly, the more complex it has become, and it's harder and harder to decouple and uncouple and unwind.
Okay, I want to jump into this analogy here about this widget. So when we say widget, though, are you talking about like the customer service person on the phone who really does want to be the person in charge of your pre-authorization, or are you talking at the macro level of like, no, me, insurance company, like, this is mine, and you're not going to penetrate it. We're going to do it my way, or it's not happening.
Oh, the big mama, right? The big mama, right? So the mothership, whatever you want to call it, the big mama. And if you look at things, so there was a company I was working with, and we actually sat down and we looked at all the prior authorizations, right? And prior authorizations being that lovely permission slip you have to use in healthcare to get the services you already paid for. Only industry ever, right? And so we were looking at prior auths, and what we realized was almost 50% of the prior auths that this company had didn't actually need to be in place anymore, and were costing the company more administrative fees than it was saving. Now, that's the company lens. Look at it from the consumer lens, the customer, the person that, the human who's trying to use it, right? And think about all that time they had to spend on the phone trying to get permission to do this thing that really didn't save any money. We ended up just literally shut down half of the prior auths. Saved the company a ton of money, and frankly, we just made their customers so much happier because we took the hoops out of the system for them.
Okay, so what would you say? I mean, really, but like this is actually like radical thinking. You did away with the pre-auth. But so how did that go? Because like I look around and I see a lot of people who've got a lot of skin in the game to keep that pre-auth there, and it's not just like for monetary reasons. It's like systems and processes and jobs and blah 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 widgets, right? Widgets. So how did you convince them to do that? Were they open to it when you're like, well, you know what we got to do? Or did they come to you and were like, we got to get rid of these pre-auths, help us out? Like, tell me a little bit about how this went down.
Sure, so great question, right? And I think one of the things that we always struggle with, especially in this industry, I'm going to keep saying that, especially in healthcare, is we look at it and we're like, oh, not mine. So what we did was I'd gotten hired by a CEO. That's how I got in the door with a construct of our scores suck, make them better. So we sat down, we identified where the fail points were. One of the biggest fail points was this permission slip, this prior auth. So we grabbed the chief medical officer, the chief actuary, the head of legal, and the head of compliance. We sat down in a room. We figured out pretty quickly we also needed the head of service, right? But little tiny note, service really isn't a part of the customer experience. Everybody knows it's not that rep's fault.
Which is ironic, because it's service.
Right, but we know that you're not making that decision. We know someone up there is making that decision, right? So we gathered everybody into a room and we just did the math. We literally just did the math. So how many phone calls was it costing us? How many reviews had to be done? And once you did the math, it was black and white.
What were the looks on their faces? Like, were they just stunned?
It was a total
Or did they know?
shock and awe.
It was a shocker. Like, they were like, oh my God, I had no idea that this was...
Shock and awe, total shock and awe. And I have to say, that was the moment. So we found this thing that we knew we had a pretty decent business case around, and it was the right thing to do. But when you married that and made that your first win, it was insane how many other things we could get through. Because we'd proven that we can save you money. You're still going to be able to control costs, right? It's not going to blow up your world, but you're also going to serve people a heck of a lot better and faster and all of the good things. And that gave us an entree into a bunch of other work that we got to do with them.
How do we scale this into like the entire industry? No, truly, because I mean, it's one thing to do one, but it's like, how do you get the rest of them to go along? Because obviously something needs to happen. Their net promoter scores are the worst. And then it's like, on top of that, it's like you've got these consumer companies, especially on the technology side now, Apple, they're like stomping in, and they're like customer experience. Yeah, like they know how to do that. It's frictionless. I can get my groceries delivered to the trunk of my car using Amazon these days in Los Angeles. Like, it's amazing. So, I mean, truly, I don't even do anything. It's one click. Somebody's going to come in. So how do you create the sea change, in healthcare to take a look at some of these things that have been like, just part of the establishments for so long that we take them for granted. We don't do the math anymore, and change that mindset and get this kind of broad scale adoption to like kind of disrupt some of the old thinking.
Yeah. Something, right? Disrupt something. So I think there's one of two things that'll happen, right? So either this industry is going to decide to work together and figure out things like, wow, okay, getting a kid's ear checked is going to cost you $20 regardless of where you go. And just standardized pricing across the US. That's number one. Number two, someone else is going to solve it and none of them will be here. It's literally going to be one of those two. So they're going to have to determine how to work together. Right? They're going to have to determine how to work together to solve the pricing, just insane complexity that's been created, right? I mean, there was a firm I was working with that had over 100,000 benefit designs. 100,000 benefit designs. I'm like, how can you do that, right?
Yeah.
So unless they decide to come together and just figure out how to standardize some of this big stuff specifically around cost, right? Specifically around cost, someone else is going to come in and solve it.
All right, you look like a betting woman to me. So who would you put your money on there? Do you think somebody is going to come outside and disrupt it, or do you think they're going to get their act together? I almost said the other word, but do you think they're going to get it together and change?
I don't know yet. So I've been in this space, right, trying to disrupt this space since the early O's. And when we were, building some of the original consumer-directed healthcare stuff, we were like, this is going to change the world. This is going to be it. We're going to change everything. We're going to make it consumer-directed, and everyone's going to, and it didn't. It didn't. So I used to say it's going to be somebody outside who's going to totally come in and do it. Someone's going to come in and do it. And then, having been one of those outsiders who came in and tried to do it, and we made a dent. We made a big dent. We didn't do it. Now I'm kind of sitting back and I'm like, gosh, I really would like it to be the incumbents to come together and fix it, because they have the wherewithal, they understand it, and frankly, they have the money.
Yeah.
So whoever created it, you could pull it apart and make it simpler.
Do you think that the want and the will to do that is there now? Like, do they get it, that it's like the writing is on the wall yet, or have they not come to Jesus yet as far as that goes?
I think that there's the beginning of some fear. Right? So inertia is a dangerous, dangerous place.
Oh, it is.
There's been a lot of inertia in this industry for a long time. And I really do think that, and we thought Oscar would be it, right? We thought Oscar was going to crack everything too. Nothing has come in and really scared the bejesus out of everybody.
Nothing's been that big.
Nothing's been that big. So unless something that...
This is like the Death Star.
It is. It's like you just keep... But Luke Skywalker totally solved it, right? I mean, was it Luke Skywalker or was it Han Solo? No, it was Luke Skywalker, right? Drove in, right? Yeah. So there is hope. And we were talking with another group earlier, and I kept saying, you just have to find the cracks. Find the cracks and expand on those cracks, right?
Okay.
Like, find those spots, because I think that's what will create the change at the end of the day.
All right, last question for you, and don't feel like you have to fit your answer into this, but last question for you. I want to ask you about the customer. And I want to ask about, from their perspective, it's like, do they have a responsibility in any of this? Because so we've been hearing the healthcare literacy and healthcare complexity, and it's like part of it needs to be the system that simplifies, but part of it also, there's like a burden on the customer. Like there's also an inertia from the customer standpoint of, it's like, well, I'm getting knee surgery. They told me to go here. Why would I even try to go someplace else? I'm not paying for it. The insurance companies, or whatever it's going to be. So, I mean, what kind of I guess my question is is there a burden on the customer here to kind of help participate in creating a better healthcare system? Or is that something that is just supposed to be inferred by where their dollars end up going later on down the road? I mean, what is your take on the customer's role in all this?
Such a big question, you know.
Well, I'm ending with a big question.
So
that's why I said don't feel free to limit your answer.
No, I'm afraid of this one. So I don't think there's a right or wrong on this one, right? I think it's a bunch of different opinions. No, but I think there's a bunch of different opinions.
Yeah,
I tend to swing to the opinion side of, we took an industry where you had no choice. We told you exactly what to do, and we told you not to worry about money. 20 years ago, that's exactly what it was, right? You had no choice. We told you what to do, and we told you not to worry about money. And now, in 20 years, with not a great approach, right? Tools aren't consolidated, information is a hot mess, we're still speaking in a language that we understand but nobody else does. I mean, all of these things. And now we're expecting you to be completely a consumer of your healthcare goods. I don't think that's fair, right? I think we have failed the human in this as an industry. I think we've failed the human. So at the end of the day, if we want people to actually be consumers, then frankly, we need to wrap this product in such a way that it's accessible.
Yeah,
that it's
make it a consumer product.
Make it a consumer product, which means I have 3 choices, right? I pay a lot, I don't pay a lot, I pay a ton, right? I mean, I don't know what they are, right? Choose your.
Or I know how much it costs. That might be nice.
and I have one of 3 choices, right? I mean, we know this about jam and jelly, right? I mean, people really only want 3 choices. There's 40, but people really only want 3. So I think as an industry, until we take the steps to actually turn it into a consumer product, I don't think we have the right to expect people to be consumers.
Okay. Fair enough. Ingrid, I can't wait to see what happens and how you're going to react to it, among other things. Thank you so much for talking with us. I'm really inspired by your story about getting rid of the pre-auth. I mean, I think that's like remarkable. It's like, wow, can I touch you? Like, that's amazing. I'm Jessica DaMassa with WTF Health. Thanks so much for joining us.